Hello, people of the universe. How are you guys doing? I just wanted to get on here. I've made videos, but I have not posted them. And I just wanted to do a shout out because I think this person's really important to go check out. Now, I met this person about 7 months ago. Her name is Rockin Roberta. She was on Suboxone for 3 years, I believe. She was primarily a opiate addict. I believe oxycodone was her drug of choice, and from my recollection, I wouldn't say she was a closeted drug addict. Maybe. She was really able to hide it in ways and keep it to herself. And she didn't steal. She didn't take money from people. And I remember the first video I watched of her was a video about where she talks about her drug dealer and how she would obtain her oxy. And it would be in a driveway, and she'd park her car and wait for him to come in the driveway. And she'd just continuously get more and more and more. And she's an amazing person. I've said it before. But the most important thing I want to say in this video is it's important to not compare yourselves to others in recovery, because everyone is different in their recovery. Everyone has different needs. Everyone has different obstacles that they have to go through, whether it be financially, whether it be environmentally, whether or not be socially, mental health wise. Like, there's so many different dynamics of recovery that, there's so many different criteria that you could hit medically. A lot of people are in chronic pain, and that is a reason why people get addicted to opiates, whereas other people just, experiment with drugs and find opiates to be one of their main choice. But what is important is that I believe Suboxone really helps people. And I think in some way it's a miracle drug. Because if it's helping someone get off opiates and aiding them to not use and have a successful story, then who are people to judge that person to go through medicated assisted treatment? That's how you call it, MAT. And I feel like a lot of people who are in recovery or, Alcoholic Anonymous and stuff like that, they say you aren't sober. You're not sober if you're on Suboxone. And I think that's like BS. And right now, she was doing a taper for a very long time. And I want to note that not everyone can do the same taper as her, because the strips are actually really expensive, insurance-wise, and a lot of people don't have access to the strips. And also, Suboxone on the streets it's probably more expensive than heroin. That is the reality that we live. And I believe that you could do it. If you go on Suboxone, you could get off Suboxone. I believe that you will know when it's time. And I also believe that there's different elements that you need to involve yourself around when it comes to getting into treatment. it's not only just taking Suboxone, it's groups, it's friends, it's people who aren't involved in drugs, it's a network, it's counseling, doctors, and a lot of people who are on Suboxone don't do these things. They don't find it important enough. And when you treat something with just a medication, you find yourself falling back. Because psychologically, your brain is conditioned so much when it comes to opiates. And yes, Suboxone fights the urge, helps the cravings, gives the brain the chemistry and all that stuff. But therapy is so important, and I'm not pushing therapy per se, but finding a good doctor who is not judgmental, finding perhaps counseling or a group that you could go to, finding something that you're comfortable with, and not just taking Suboxone. And the main thing I want to talk about is this is her last day on Suboxone. And, you know, I actually have been mentioning this to my patients because one patient is getting off Suboxone, and I mentioned her without listing her name or any information whatsoever, and I said, oh yeah, I have a friend getting off Suboxone. And knowing people in my private life who are on Suboxone versus people who are in a clinic, a public clinic, is very different. I give this woman lots of props, emotionally, physically, mentally. I believe she's a very strong woman, and I believe she could do this, and she is doing it, and that's why I'm giving her a shout out right now. And she tapered really properly, and that is why I believe it's successful. And she has her own care package, and you should check out the recent video of her withdrawal care package. And it's really important to take care of yourself. She's taking care of herself, and that's really good. But follow her journey. Follow her journey of the withdrawal symptoms, withdrawing off Suboxone. See if these withdrawal symptoms are as worse as withdrawing from opiates. Will it scare you to go on Suboxone? Because I know a lot of people are like, no, don't do it. It's worse than getting off heroin. It's worse. Like, I get really angry when people say that, because you don't know. You don't really, like, maybe it didn't work out for you, but it could work out for other people. So that's why I'm making this video. And I am sharing her story, and I'm there for her as a friend, and I am saying, hey, if you have any interest on watching someone who's getting off Suboxone, this is her last day. No more Suboxone for her. She's going to document her journey. Go to her channel. Her channel's name is Rockin Roberta, and I'll put the link down below. Bye.